I'm April Knopf, and I am a respiratory therapist and a clinical specialist here at University Hospital.
My name is John McLouth. I'm a registered respiratory therapist. I work and serve IU Health as a clinical specialist in the cardiovascular critical care unit. I've been a respiratory therapist since 1980, so 43 years. A respiratory therapist is a fairly new profession. We just celebrated 60 years as a state society this year. So compared to nursing and medical practice, you know, we're still infants, but we're working hard to find value, to collaborate with our physician partners and our nursing partners to really add value at the bedside.
A respiratory therapist, we take care of patients with lung conditions, so asthma, COPD, bronchiectasis, emphysema, cystic fibrosis. So these patients, you know, require breathing treatments and different therapies that we can do to help clear their lungs. This is our ventilator. We put this on our patients that require respiratory support. So often in this unit that I'm in, the surgical ICU, we would put it on a patient that just had surgery and maybe they were still under sedation and needed a little bit more support breathing. We put an endotracheal tube down you, which I don't have present, and we would hook this piece up to the ventilator to the patient. And then based off of your patient, you know, if it's a male or female, how tall they are, that will help us decide like how big of breaths you will take.
The CVCC, we work with a lot of patients post-operatively, recovering them from surgery, so we ventilate them until hopefully we're able to extubate and get their breathing tube out.
I love obviously seeing my patients get better and get out of here. That's a huge part, and you know, that's something you always see, unfortunately. But I also like seeing people grow. So I do a lot of education as well. I'm a clinical specialist, so I train a lot of the new hires, and that's pretty cool to be able to see them through the beginning, whether they were a student and then they graduate and we take them on and get them like feeling really confident in themselves and then being on their own and being able to handle all these difficult situations.
It's a very rewarding career. You know, when somebody can't breathe, nothing else matters, and you are somebody that can participate in helping make a difference.